Which technique is used to stop the heart during cardiothoracic surgery? Option 1. Defibrillation. Option 2. Cardioplegia. Option 3. Ablation. Option 4. Pacemaker insertion. The answer is Option 2. Cardioplegia. What is the role of physical therapy after cardiothoracic surgery? Option 1. To increase heart rate. Option 2. To prevent blood clots and improve mobility. Option 3. To reduce pain. Option 4. To enhance medication absorption. The answer is Option 2. To prevent blood clots and improve mobility. Which condition is a contraindication for heart transplantation? Option 1. Coronary artery disease. Option 2. Irreversible kidney failure. Option 3. Dilated cardiomyopathy. Option 4. Severe heart failure. The answer is Option 2. Irreversible kidney failure. Which surgical procedure is used to treat mitral stenosis? Option 1. Valve replacement. Option 2. Valve repair. Option 3. Balloon valvuloplasty. Option 4. Heart transplant. The answer is Option 3. Balloon valvuloplasty. What is the main purpose of chest tubes after cardiothoracic surgery? Option 1. To administer medications. Option 2. To prevent infections. Option 3. To drain fluid and air. Option 4. To stabilize the heart. The answer is Option 3. To drain fluid and air. What is a common long-term complication of cardiothoracic surgery? Option 1. Scar tissue formation. Option 2. Heart failure. Option 3. Pulmonary embolism. Option 4. All of the above. The answer is Option 4. All of the above. What is the primary purpose of echocardiography? Option 1. To measure blood pressure. Option 2. To visualize heart structures. Option 3. To monitor oxygen levels. Option 4. To perform stress tests. The answer is Option 2. To visualize heart structures. Which type of echocardiography provides detailed images of the heart via the esophagus? Option 1. Transthoracic echocardiography. Option 2. Stress echocardiography. Option 3. Transesophageal echocardiography. Option 4. Doppler echocardiography. The answer is Option 3. Transesophageal echocardiography. What does a stress test evaluate? Option 1. Heart response to physical exertion. Option 2. Lung function during exercise. Option 3. Blood pressure fluctuations. Option 4. Kidney function. The answer is Option 1. Heart response to physical exertion. Which imaging modality uses magnetic fields to assess heart tissue? Option 1. Echocardiography. Option 2. Cardiac MRI. Option 3. Cardiac CT. Option 4. Nuclear cardiology. The answer is Option 2. Cardiac MRI. Which diagnostic tool is most commonly used for detecting coronary artery blockages? Option 1. Cardiac MRI. Option 2. Echocardiography. Option 3. Cardiac catheterization. Option 4. Stress test. The answer is Option 3. Cardiac catheterization. What is the purpose of nuclear cardiology? Option 1. To evaluate blood flow and function using radioactive tracers. Option 2. To visualize heart valves. Option 3. To measure electrical activity. Option 4. To assess lung function. The answer is option 1. To evaluate blood flow and function using radioactive traces. Which stress test involves injecting a radioactive substance? Option 1. Exercise stress test. Option 2. Nuclear stress test. Option 3. Dobutamine stress test. Option 4. Tilt table test. The answer is option 2. Nuclear stress test. Which diagnostic tool combines X-rays with computer processing to create detailed heart images? Option 1. Cardiac MRI. Option 2. Echocardiography. Option 3. Cardiac CT. Option 4. Nuclear cardiology. The answer is option 3. Cardiac CT. Which is assessed by Doppler echocardiography. Option 1. Heart valves. Option 2. Electrical activity. Option 3. Blood flow. Option 4. Heart size. The answer is option 3. Blood flow. What does cardiac catheterization directly measure? Option 1. Blood pressure in heart chambers. Option 2. Heart rate during exercise. Option 3. Electrical activity of the heart. Option 4. Oxygen levels in the lungs. The answer is option 1. Blood pressure in heart chambers. Which diagnostic tool is considered non-invasive and highly accurate for diagnosing coronary artery disease? Option 1. Cardiac CT. Option 2. Cardiac catheterization. Option 3. Stress test. Option 4. Nuclear cardiology. The answer is option 1. Cardiac CT. What is the purpose of myocardial perfusion imaging in nuclear cardiology? Option 1. To evaluate heart valve function. Option 2. To detect blockages in coronary arteries. Option 3. To assess lung function. Option 4. To measure electrical activity of the heart. The answer is option 2. To detect blockages in coronary arteries. Which test involves a patient walking on a treadmill while monitoring the heart? Option 1. Nuclear stress test. Option 2. Exercise stress test. Option 3. Tilt table test. Option 4. Dobutamine stress test. The answer is option 2. Exercise stress test. Which imaging modality provides real-time images of heart valve movement? Option 1. Cardiac CT. Option 2. Echocardiography. Option 3. Nuclear cardiology. Option 4. Cardiac MRI. The answer is option 2. Echocardiography. What is a key advantage of transesophageal echocardiography over transthoracic echocardiography? Option 1. It is non-invasive. Option 2. It provides clearer images of the heart. Option 3. It monitors blood pressure. Option 4. It measures oxygen saturation. The answer is option 2. It provides clearer images of the heart. Which diagnostic tool is most useful for assessing heart muscle viability? Option 1. Cardiac MRI. Option 2. Echocardiography. Option 3. Nuclear cardiology. Option 4. Cardiac catheterization. The answer is option 3. Nuclear cardiology. What is the primary purpose of stress echocardiography? Option 1. To evaluate blood flow during rest. Option 2. To assess heart function during stress. Option 3. To measure electrical activity. Option 4. To detect lung disease. The answer is option 2, to assess heart function during stress, which is a major complication that cardiac catheterization can help identify. Option 1, heart arrhythmias. Option 2, valve regurgitation. Option 3, coronary artery stenosis. Option 4, heart failure. The answer is option 3, coronary artery stenosis. Which diagnostic test is best for detecting congenital heart defects? Option 1, stress testing. Option 2, echocardiography. Option 3, nuclear cardiology. Option 4, cardiac CT. The answer is option 2, echocardiography. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life. What is the purpose of pharmacological stress testing? Option 1, to exercise the patient physically. Option 2, to induce stress using medications. Option 3, to directly measure blood pressure. Option 4, to visualize heart valves. The answer is option 2, to induce stress using medications. Which radioactive substance is often used in nuclear cardiology tests? Option 1, iodine 131. Option 2, technetium 99 meters. Option 3, fluorine 18. Option 4, carbon 14. The answer is option 2, technetium 99 meters. Which test uses gadolinium contrast to assess heart structures? Option 1, cardiac MRI. Option 2, cardiac CT. Option 3, nuclear cardiology. Option 4, stress echocardiography. The answer is option 1, cardiac MRI. What is a major benefit of cardiac CT angiography? Option 1, it provides immediate results. Option 2, it requires no contrast material. Option 3, it is non-invasive. Option 4, it does not require any preparation. The answer is option 3, it is non-invasive. Which type of echocardiography uses a high-frequency sound wave to measure blood flow? Option 1, M-mode echocardiography. Option 2, 2D echocardiography. Option 3, Doppler echocardiography. Option 4, 3D echocardiography. The answer is option 3, Doppler echocardiography. Which imaging modality uses ionizing radiation for cardiac imaging? Option 1, cardiac MRI. Option 2, echocardiography. Option 3, cardiac CT. Option 4, stress test. The answer is option 3, cardiac CT. Which class of drugs is commonly used to manage hypertension? Option 1, beta blockers. Option 2, antibiotics. Option 3, anticoagulants. Option 4, diuretics. The answer is option 1, beta blockers. What is the primary mechanism of action of ACE inhibitors? Option 1, blocking calcium channels. Option 2, inhibiting angiotensin converting enzyme. Option 3, reducing sodium absorption. Option 4, stimulating beta receptors. The answer is option 2, inhibiting angiotensin converting enzyme. Which drug is commonly used to treat angina pectoris? Option 1, nitroglycerin. Option 2. Aspirin. Option 3. Metformin. Option 4. Warfarin. The answer is Option 1. Nitroglycerin, which is a common side effect of beta blockers. Option 1. Increased heart rate. Option 2. Fatigue. Option 3. Constipation. Option 4. Nausea. The answer is Option 2. Fatigue. Which drug is used to control heart rate in atrial fibrillation? Option 1. Amiodarone. Option 2. Ibuprofen. Option 3. Amlodipine. Option 4. Digoxin. The answer is Option 4. Digoxin. Which of the following is an anticoagulant? Option 1. Aspirin. Option 2. Warfarin. Option 3. Atorvastatin. Option 4. Nitroglycerin. The answer is Option 2. Warfarin. Calcium channel blockers primarily affect which aspect of cardiac function? Option 1. Heart rhythm. Option 2. Blood vessel dilation. Option 3. Clotting factors. Option 4. Cardiac output. The answer is Option 2. Blood vessel dilation. Which antiarrhythmic drug is a potassium channel blocker? Option 1. Lidocaine. Option 2. Amiodarone. Option 3. Adenosine. Option 4. Verapamil. The answer is Option 2. Amiodarone. Which is a common side effect of statins? Option 1. Muscle pain. Option 2. Increased appetite. Option 3. Hair loss. Option 4. Diarrhea. The answer is Option 1. Muscle pain. Which is the primary action of diuretics? Option 1. Lowering cholesterol. Option 2. Reducing water and salt retention. Option 3. Blocking beta receptors. Option 4. Increasing cardiac output. The answer is Option 2. Reducing water and salt retention. Which medication is often prescribed to prevent blood clots in patients with atrial fibrillation? Option 1. Atorvastatin. Option 2. Warfarin. Option 3. Nitroglycerin. Option 4. Metformin. The answer is Option 2. Warfarin. Which of the following is a beta blocker? Option 1. Losartan. Option 2. Metoprolol. Option 3. Aspirin. Option 4. Furosemide. The answer is Option 2. Metoprolol. Which is the function of antiplatelet drugs like aspirin? Option 1. Prevent blood clotting. Option 2. Lower blood pressure. Option 3. Reduce heart rate. Option 4. Dissolve existing clots. The answer is Option 1. Prevent blood clotting. Which drug is used as a first-line treatment for acute heart failure? Option 1. Furosemide. Option 2. Digoxin. Option 3. Nitroglycerin. Option 4. Adenosine. The answer is Option 1. Furosemide. Which drug inhibits the sodium-potassium ATPase enzyme in cardiac cells? Option 1. Digoxin. Option 2. Amiodarone. Option 3. Warfarin. Option 4. Lidocaine. The answer is Option 1. Digoxin. Which is the primary action of ARBs? Angiotensin receptor blockers. Option 1. Block angiotensin 2 receptors. Option 2. Increase heart rate. Option 3. Dilate coronary arteries. Option 4. inhibit beta receptors? The answer is option 1, block angiotensin II receptors. Which drug is an example of a lipid-lowering agent? Option 1, aspirin. Option 2, atorvastatin. Option 3, lisinopril. Option 4, verapamil. The answer is option 2, atorvastatin. Which is a common side effect of ACE inhibitors? Option 1, dry cough. Option 2, nausea. Option 3, fatigue. Option 4, blurred vision. The answer is option 1, dry cough. Which medication is used for rapid control of supraventricular tachycardia? Option 1, adenosine. Option 2, digoxin. Option 3, lidocaine. Option 4, amiodarone. The answer is option 1, adenosine. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life.